Hi MedFlight team, this is Corey Martinez, your Chief Flight Nurse. We're going to do something a little bit different with the newsletter, the JetStream. We're going to do a videographer session rather than doing the paper newsletter. So thanks for tuning in, we appreciate it. So I kind of want to get started today by talking about our need for medical staff. We are, at this point, need some more nurses. And so if you guys know of anyone with at least 3 years of critical care or ER experience, that are interested in flight, kind of as a PRN gig, go ahead and give them my email and we'll review the resume and go from there. So we appreciate the good referrals. Another subject that I kind of want to touch base on that's new for us as far as the medical side goes is doing we're starting the 8-shift pay. And so this is a little incentive program that we're trialing out to see if it works for everybody. So what happens is when you give your availability, if you give me at least 8 shifts for the month, then you'll get $200 on-call pay versus just the $100 on-call pay. This is a way that we can really just say thank you to the medical staff for those who participate a little bit more and give extra shifts. So we're actually really excited about this program. With that being on call, we just expect that you, again, come and check your equipment, checking expiration dates, come to classes. All of those things matter. Do your peer review, your basic on-call stuff, and we may need a little extra help during kind of this CAME season as we progress for those people. If you cancel shifts, if you're not really doing the things that you're supposed to do on those on-call shifts, then there's a potential that could be taken away, the $200 on call. So just to make everybody aware of that. But if you have any questions or any concerns about it or anything, just let me know and we'll it's open for discussion. So we'll kind of go from there. All right, so moving on to operations. A couple of things that we want to touch base on. The aircraft and ambulance checks, they're going to be scheduled on the calendar and also on the crew schedule as well. So remember that if you have a pound sign by your name, that means you have ambulance checks. So you don't need to check equipment that day. The normal sets, go ahead and just check the ambulance. The aircraft and ambulance checklists are located with all the other equipment checklists in the equipment room. So for aircraft checklists, part of going out there is you're not only checking the backup equipment, that red bag, making sure the oxygen tanks are full, all of that stuff, but you're also cleaning the aircraft. So this is a chance, there's a vacuum out there, wipe it down. We should be wiping the aircraft down after every single patient flight. So we need to make sure that gets done. There has been a couple complaints from pilots, from maintenance staff, and aircrafts that we've gotten in that there's a lot of trash, flush wrappers, caps, that kind of stuff. So when you're done with your flight, do a quick once over, look between the seats, make sure you're getting all that trash, wiping the aircraft down, making sure everything's nice and clean. With that, check at the end of your flight, make sure oxygen levels, you're reporting that to the pilots, telling them what that level is. If it's at 1500 PSI, that oxygen needs to be refilled. And again, passing that information on to the pilots. I personally, it's a really good practice to check your oxygen prior to the flight. Even though we have this practice of afterwards making sure your oxygen's at 1500 PSI, check it before your flight just to make sure you're golden for the flight. And if you need to take backup tanks, go ahead and take those. Remember, if you use the E-cylinders in the back of the aircraft, remember to switch those out and put a new green seal on those. Those are located in the hangar. As you're cleaning and even restocking the aircraft, so that includes some of the convenience bags, trash bags, that kind of stuff. Those are all located in the white locker, and that's kind of off to the southeast corner of the hangar. And in that we have trash bags, we have extra cabbie wipes, Clorox wipes, convenience bags as far as we have the lemon swabs and kind of all that stuff that's in there. So go ahead and restock after the aircraft too. If you notice something is getting low, let us know and we'll restock it. I do want to touch base inside the aircraft, those IV poles. There should be 2 IV poles in each aircraft. Just be sure that you're not over tightening those. Those are just a hand tight. What's happening with with some of them is that they're getting over tightened, and then the kind of aluminum mechanism in the middle is bending, and then they won't actually stay up. So just go ahead and remember that. The next subject I kind of want to talk about is the pre and post flight briefings. So remember to do these with your pilots. As many crew members as possible, get them involved. So really we should be talking about weather, ETA times, whether we've contacted dispatch and they're in the loop with things, the oxygen levels, your patient status, kind of all of these things need to be talked about. If you have any issues during the flight, talk about those in the post-flight briefing. Your captain, he's a great resource to really talk about what alarm went off during the flight, or if there was a weird noise or a feeling or whatever it was, just talk to your captain and they can kind of explain some of those aviation mechanisms to you. That's really helpful just for further education. If there are any incidents, go ahead and report those. You can do them in the critical notes in IntelliJet, or you can type us an email, or we have the incident reports themselves. So remember to go ahead and do those. And yeah, we appreciate that. Okay, moving on to equipment. Please go ahead and report any equipment failures. If you have chargers that don't work, or your equipment was plugged in and then lost a charge suddenly, we will switch that out right away. So go ahead and put it on my desk, leave me a note, but we need to be aware of those issues so that we can fix them in a timely manner. With equipment checks, remember to come and check your equipment prior to 10 a.m. And if you're not able to check equipment, go ahead and text me and let me know what's happening. So with that, I want to talk a little bit about narcotics. So I know that the narcotics are kind of out of sight, out of mind. They're in a different drawer. But please go through those checklists. There's neon signs kind of posted by the front desk. There's neon signs posted by the narcotics, just to not forget those, okay? So have that conversation with your medic, with the people who load the equipment. If we loaded the equipment for you, a lot of times we'll leave that up to the nurse and the paramedic to get those narcotics. So please, please don't forget those. Do those quick checklists as you're leaving the office, just so you're not forgetting anything on those flights. So when you do call for report, obviously the nurse is going to call for report. Most of the time the medic loads the equipment. On the flight itself, be sure that you're calling for report from the, you're calling report to the receiving facility. So this is when you land in, let's say you're going to Salt Lake. You land in Salt Lake, get the patient transferred to the ambulance. When you're en route, go ahead and call the receiving facility, let them know of any changes in flight. This is a good opportunity to sometimes give them report, because oftentimes they, the sending facility hasn't called for report. And so it really just helps kind of streamline the process of turning over patient care. So please just remember that. Go ahead and document that in your narrative as well. And I promise that will make your life easier if you just go ahead and give it an updated report and an ETA. And then it makes transitions faster too, so which is always really nice. Talking a little bit about wheels up times. I know that that's something that we are constantly striving for, and so our goal is to be wheels up within an hour or bedside within an hour. And so with that, having your flight stuff ready to go, calling report in a timely manner. Just because you don't have report and you kind of know the journal of the patient, you can always head out to the airport and get a report at a little bit later time prior to takeoff. So you don't have to actually be here in the office for that report. Make sure it's thorough, make sure you're getting all the details that you need prior to leaving though. So CAMES is coming. It's that time. So CAMES is going to be here June 26th and 27th. That's a Monday, Tuesday. So we are going to kind of start gearing up towards that. So I would really appreciate everybody's help to kind of get things ready. Making sure the equipment, we check all the expiration dates. That includes syringes and IV tubing and really everything that's in those sets. If it is expired, please switch it out right away. They'll go through the sets with a fine-tooth comb. They'll check expiration dates on medications, literally everything, even your IV tip caps, all of those things. If we need to order more stuff, let me know. Put it on the list so that we can get it ordered in a timely manner. So I really appreciate that. So during the CAMES, the Monday, Tuesday, 26th and 27th, there will be interviews. There'll be interviews with the crews that are on duty. There'll be obviously kind of admin interviews and all of that. So I appreciate your help with that and kind of getting everything ready. I may request some, we have to have our certifications up to date and ready to go. I know that you guys have all your certifications. I just need all the current records, okay? So if you know that you're missing some of those, go ahead and get those to me right away, and I'll send out some emails just to let you know what people are missing. So on to billing. So remember that the billing is going to come through on OneNote, and we can get all of our signatures on there. Please be sure that you're getting the patient's social security number. Oftentimes when they send over a face sheet, it just has the last four of the social, or they're all X'd out, so we don't know that. So get that from your patients. Most of them are talking, or they have a family member that knows it. Go ahead and get that information. It really just helps kind of streamline the process. So it really helps us out a lot. Turnover signatures, be sure you're getting those. And the crews are signing the turnover as well. So there's a spot for each medical crew, and there's also a spot for turning over patient care to the nurse, the physician, whoever it is that you're turning care over to. So please be sure to get those. Save those. Those will be in your report that you upload to EMSRX. So please go ahead and get those. On the pay stubs, I just want to remind you that when we do have the pay stubs come out, to access your pay stubs, it'll be the first four letters of your last name and the last four numbers of your social. So that's how you access it. Go ahead and take a look at everything. If you have any issues, contact me right away. Let me know what's going on so we can see if we can figure it out. I do want to point out, just remember that in the top, I believe it's the right-hand corner of the pay stub, there is the pay stub dates, okay? So make sure that what's on your pay stub kind of correlates with those dates. If it's outside of those dates, it's probably going to be on the next pay stub, or it was on the previous pay stub. So go ahead and just pay attention to that. But yeah, I think that's it for billing. Thanks.
Hi everybody, Aaron here. I wanted to take some time to talk about the education calendar and some opportunities coming up in the next couple of months. First and foremost, we have our Critical Care Mini Conference. That's July 14th and 15th here in Albuquerque. If anyone is interested in attending, let me know. Do not register online. We're going to send several individuals from MedFlight to the conference. So I'll be sending out the information with a list of the agenda and all the speakers. It's a great opportunity to get some critical care CEs for nurses and medics and RTs as well. So if you're interested, definitely let me know. Again, don't register online. We're going to send some folks from MedFlight to the conference. In regards to AHA classes coming up, if you have anything expiring in June, let me know right away so that we can get some classes scheduled. We're working with Lifeguard and some of their instructors. They have folks that need classes as well. I think it's better if we can combine those, a few from their service and our service, and then also gives their instructors an opportunity to teach classes as well. So if you have any AHA certs expiring, BLS, ACLS, PALS in the next 30 or 60 days, let me know right away. We will be hosting an ACLS EP course in July. The EP course is the Experienced Provider course. So for those of you who have had ACLS, the EP course is a great opportunity for experienced providers to come in and do some advanced ACLS skills and scenarios. That's going to be on July 24th. And then we're going to follow that with a full PALS course on the 25th and 26th of July. So let me know if you're interested in attending those courses. Also, remember to check the education calendar monthly that usually Stat or Corey sends out. And if there's any classes that you would like to take and or teach, let us know, and we can certainly get it put on the calendar. We want to get as much information out to folks as we can. So again, if you have any questions, give me a call or give Corey a call. Thanks.
Hey MidFlight team, this is Greg, your safety officer here at MidFlight. I just wanted to cover a few things this month for the newsletter. Primarily I wanted to quickly cover our incident reporting system and how we deal with incidents that happen out there on our calls. Most of you know there's something happens, of course you usually tell us directly, Corey, myself, Aaron, Stat, the management team. But there's also, of course, the incident report forms that we have you fill out occasionally, depending on the severity of the report or the incident itself. Most of the time, what we do then is we take that report, we investigate, we interview you, we interview all the people involved, we write a report, we do what's called a root cause analysis, especially direct safety incidents, things with mechanics, communications, any sort of a direct safety issue, and certainly medical, peripheral medical issues. Once we do that investigation, we interview everybody, we come up with a root cause analysis, try and find the root cause, and then try and develop a plan to fix that root cause analysis. And it can be anything from a simple one-day fix right there to an ongoing investigation / 2 weeks of 2 months of situation, depending on the situation. Maintenance, for instance. We've had issues like, for instance, and I'll talk about this briefly, like the door. We've had a couple incidents with the door this month where the door release latch has caused some problems. They've been in the wrong position. So we're doing an ongoing investigation as to why that's happening, but that's on the maintenance side and the management side. So that's just an example. When we do complete that, I send those reports to you, and certainly when you get those, you're willing to come back to me for further talk about it, maybe update the report itself, and then if you want to also as well, be participant in the follow-up. So that's basically how our safety system works here. It's really nice that we're such a small company that we can kind of do this in direct face-to-face contact with myself, our maintenance people, certainly everybody in the management team. On that note, I do want to talk about the door issues. We've recorded a couple videos, one specifically relating to the last incident where the door release switch has become out of its positioning. And so hopefully we'll have that down here on the bottom of the screen here that you can go to and watch. It just kind of covers that issue. Just a short 5-minute video on what to watch for, especially now that it's happened twice in about a quarter. And then finally, we're doing CAMES, of course, this in about a month, and we have been CAMES sent out to all employees a CAMES safety survey actually, and a lot of people probably with the spam. We have less than 50% response at this point. So if we could have you, if you have a chance, please, and again we'll have a link down here on the screen below on where to go. If you do not have it in your spam, if you do not have it in your email already, to go to and just take a quick survey of our safety system and safety here. It's just anonymous. It gives us a great idea of where we stand from the employee's perspective, from us and for CAMES to see our participation. That's all I've got this month. Thanks a lot and have a good day.
Hey team, Stat here. Just wanted to touch base on just a couple of things about IntelliJet. As you know, we've been making a lot of changes, but we've certainly gotten to the point now where everything's coming together pretty good. I think we've got the whole second tablet mode down. I know we have a couple of just minor tweaks to fix here and there, but we definitely want to get that working for you, and I'm pretty sure you're probably appreciating that second tablet mode a lot. We know there's some issues with the billing signatures as far as downloading the pages, but we're working on that, and we're going to have that fixed for you, I promise. As Corey mentioned, those do download into OneNote, and then the patient or signing agent can easily sign right into OneNote. As always, if you have any suggestions or comments about IntelliJet, we definitely want to hear about it. I also want to talk about some error messages. Occasionally we're getting some error messages, and usually I find out about them the next day or whatever the case might be. Please don't hesitate to give me a call, send me a text message, maybe even take a picture so I know exactly what the error message is. There's so many different places that there's potential for those error messages, and so if I don't know exactly what it is, it's hard for me to find it. Other than that, it seems like everybody's getting the hang of it. It looks like all of your vital signs, everything's like that is getting entered correctly. We're going to move a couple of things. For instance, the part where it says the chief complaint, why the patient's being transported, that kind of stuff. So the next time you log into IntelliJet, just kind of keep an eye out for that. It's going to be in a different spot. We probably won't send out a video specifically on that, which is why I wanted to mention it here. Other than that, again, everything looks like it's coming together. Everybody seems like they're doing pretty good with it. And again, if you have any issues or concerns, please contact me at the time that you have those. Don't hesitate. I'll certainly be happy to go over those with you. I guess that's it. We'll talk to y'all soon.
Hello team. I would like to ask if all the pilots and medical crew to help out dispatch. Flight Tracks, the flight following program used by dispatch to follow our crews while in the air, has gone out of business. We're currently searching for a replacement program, but in the meantime, I have had a discussion with Gary and Corey and believe we have a temporary solution in which dispatch will need the help of both medical and pilots. What I would like is before the medical crew calls dispatch with their wheels up time, is to ask the PIC what their ETA to their destination is. Dispatch will then have an accurate wheels down time. On our patient legs that are over an hour and 15 minutes, I would like to have the pilots call dispatch on AirInc when they are 45 minutes out so they can update dispatch with their ETA. This will allow dispatch to then give accurate ground time ETAs to ground ambulance and our clients that might be setting up the ground ambulance. On non-patient legs, dispatch just needs an accurate ETA of when the plane will be wheels down so we can make sure the crew has a ride back to the office if needed. If you have any questions, please feel free to get with myself, Gary, or Corey.
Hey team, Larry wanted to mention something before we go. He wanted to remind you that the weather can be different everywhere we fly, so try to take into consideration the weather of where you're going. Figure out if you need to take a jacket, maybe wear a long sleeve shirt, whatever the case might be. Yesterday, for instance, the weather was really nice here in Albuquerque, but where we flew to in Salt Lake City, there was freezing rain and we ended up on the ground for a little while. So if you're not prepared for those situations, they can very well become very uncomfortable. So just keep that in mind.
All right, guys, thank you for tuning in to our video newsletter. The next newsletter will come out in July. We just want to let you guys know that we appreciate you so much and you really do make up this company. Please give us the feedback in the comments below, and then we'll see you next time. Thanks, guys.
Don't forget to subscribe.
Don't forget to subscribe.
Ba! 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 We have the same video.
All of us sing.
Yeah, so you're here and she's there. Yeah, you're both kind of in. Yeah, that's good.
We're in, we're out. We're in. Yeah.
But it's,
We're in. Oh, what do you...
Oh, we got it.
This is what we really do at MedFlight every day. I'm out of here.